Hey guys, this is Dr. Mahajan from Mahajan Medical Center. Very excited with the new show in 2021. I want to wish all our audience happy 2021. Hopefully, it's going to be a joyful and healthy and uh, wonderful year, and we'll put the COVID-19 behind us. Hopefully, by next 6 months, a year, and all of us get vaccinated and keep using our social distancing, and we'll be in a better space in 2021. We got a very special guest today, my dear friend Dr. Sondhi. He's a very well established and well known local gastroenterologist. Uh, Folks who are tuning in for the first time, my name is Dr. Ranjan Mahajan. I'm a board certified internist here in Largo, Florida. And we do this uh, live webcast for since March of 2020. And we've been very successful in getting a good, healthy, and hopeful message out for our community about various health conditions or lifestyle changes. And on the same vein, we were very excited when Dr. Shanti accepted my invitation to come and talk to us and educate all of us about the GI health. And the gut is everything. If you don't have a good gut feeling, you're in big trouble. So if you have a good gut health, we got everything going well. We're going to get Dr. Sandhi on our program in a minute. You enjoy this short video. At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting. Hi, we're back. Thank you for watching our short video. Let's get Dr. Shanti on our show, and here we go. Hello, Dr. Shanti, how are you?
I'm very good, Dr. Mahajan. Thank you very much for inviting me to your show. And I thank you on behalf of the community of Tampa Bay for doing this service, which I am incredibly grateful to you to do that.
That's very kind words, Dr. Shanti. And we share a lot of things in common. And you do a very good job with taking care of people's gut health. So we're very excited that you're going to share that wisdom with all our audience today. Let's go back, and if my memory me right, you came here about 23 years ago, correct? In Tampa Bay area.
That's correct.
Long time. So your practice has grown. You're part of a big group. Tell us a little bit about your journey. Where you did your residency and fellowship, and how you got to Tampa Bay.
Okay, well, it's a kind of long journey. I did my med school, actually, interestingly, from the same medical school as Dr. Mahajan did, but we never crossed paths in India. So first time we ever met was on Clearwater Beach, and we were surprised. So I did my residency in Cleveland. I was there for actually long time. I did my 3 years of residency from Health Cleveland, which is now affiliated with Cleveland Clinic. And then I did my fellowship from Metro Health Medical Center, which is also in Cleveland. I did the first year of my fellowship in the research in alcoholic liver diseases. We did basic research in rats, and we were working on some therapeutic models, which to this day, the research is still continuing. Then I finished my fellowship in 97 and came to town. And I've been here, started off as a solo practitioner, and gradually grew up into this big group. We have about 31 providers, all gastroenterologists in our group, spanning Pinellas County and Hillsborough County.
Right. So it's called Florida Gastro, correct?
It's Gastro Florida, actually.
That's the other way around, Gastro Florida.
Right.
And you practice in Clearwater, correct? Sunset Point, that's where your office is?
Yes, Belcher and Sunset.
And you also go to Means Dunedin, Means Countryside Hospital, Modern Plan Hospital, and Bay Caroline, correct?
That's correct.
So that's a lot of coverage, in the office practice. So kudos to you to maintain all that for 23 years.
Well, hopefully we'll go another 50 more years.
So what got you interested in gastroenterology? Are you always interested in the shitty things?
Absolutely. Well, to be very frank, yes. So, when I was doing my residency, I checked all the different specialties, and gastro was one thing I really enjoyed doing it. And, looking at somebody's guts with a camera it gives you a very unique experience. And I think we are very privileged that we can do that. And also, I had a special interest in liver diseases, as I was telling you about my special interest in liver diseases. So I was always interested in doing liver, but they all tie in very nicely to each other. So I had a passion for gastro. And initially, I was embarrassed to tell everybody that, what, I like GI. And but my family supported me, and one thing led to another, and it's been a great journey, and I thank God every day. It's been I had a chance to working with nice people like yourself.
Oh, that's very kind. And it runs in your family. Your brother-in-law, Dr. Glamour, is a gastro too, right?
That's true.
All right, let's talk about the topics we have today. So you brought beautiful slides with you, so we're going to be sharing that with our audience. So you want to start with the GERD, or acid reflux. That's what you were saying. It's so common in your practice. A lot of patients, and in our practice too, in primary care as well, we see a lot of folks with acid reflux. So so we'll start with that. I think that's great to talk about what can be done lifestyle-wise to reduce the impact of it. Could be debilitating, so that's a great topic you brought. And then you want to talk about bloating, and your favorite topic, farts, the gas coming out from top and bottom. So I know it sounds funny, but some people get embarrassing, so it's good to talk about that topic. And then the topic which everyone wants to talk about is the stomach cancers, just in a genetic name, but stomach means just the whole gut. So stomach and esophagus and liver and pancreas and colon. So that's what you have in mind, right?
Absolutely.
All right.
It's
So we
hard.
got a lot to cover. So let's get started. So we got one of your fans saying something about you here. Angie Kamensky answer saying Dr. Sondhi is the best, and I totally agree with you, Angie, that he is the best. So thank you for
Well,
tuning in, Angie. And we got Sandy saying, hi, Dr. Mahajan, great info. And she got spick and span as her picture. So let's bring the slides in here, and here we go. So the first topic we're going to talk about is the GERD, or the gastroesophageal reflux disease. And as you can see in this picture, the acid is in the stomach, which is this pink organ here, and then the yellow thing is the hydrochloric acid, which is one of the most caustic or most strong acid out there, and it can go up as we get older. The sphincter here get laxed, and Dr. Shani going to go at length. What are the signs and symptoms and diagnosis? How is that made, and what kind of lifestyle changes we can do to improve it? So let's get into it. Okay, here we go. Let's see.
Thank you, Ranjan. So let's start off with the acid reflux. So what is acid reflux? You can be, it can be known as heartburn, acid reflux, GERD, or gastroesophageal reflux disease, which is the medical name of this thing. So we have a lot of people, almost 40% of the population will experience heartburn at least once a month. And about 10% of the population will feel it at least once a week. So you can imagine millions and millions of people have this condition. So it's a condition where you're feeling like a burning sensation at the back of your throat. But that is the most common scenario. But then there are very other atypical manifestations of reflux. Some people can experience chest pain, some people can have regurgitation, some people can present with nausea or vomiting. So you never ever ignore it saying that, oh, it's just a reflux. Oh, it's just a little heartburn. If somebody has acid reflux for more than 2 days a week, it needs to be at least discussed with the provider, with the family doctor. And if it is more persistent, it could be a sign of something bad. So my first advice is never ever ignore your reflux because it could be a sign of something bad. Now, if you have it once a week, think about it. If it's more than that, of course, do something about it. And if it is once a month, when you have a heavy meal, late night dinner, I think it's okay. You can maybe get by with some antacid like Tums, or there are a lot of over-the-counter products. There's Pepsid, which you can take. But if it is lasting for more than 3 years, then I think you should absolutely be evaluated by a specialist because it can lead to complications. The number one and the most dreaded complication is it can cause a precancerous condition where the inner lining of the food pipe changes, and it is called Barrett's esophagus. How can that be diagnosed? Only by endoscopy. When we do endoscopy, we go with a camera down the mouth, into the food pipe and into the stomach, and then we go into the early part of the small intestines. Then we look all around, and if we see some changes of acid reflux, we take biopsies. If you have Barrett's, do not panic. We have great treatments for that. You got to take some medicines to cut down the acid in your stomach. And then there's a very important role of lifestyle changes. Then there are other complications where if you have long-standing acid reflux, it can lead to a stricture, which means the narrowing of the food pipe. It can also cause ulcerations. It can sometimes bleed from there. So there are a lot of other conditions which can be a direct result of heartburn or acid reflux. Now, if you have it, of course,
Yeah, so let's talk about lifestyle changes. The Barrett's is precancerous, but let's hope someone doesn't have that. Even if they have that, these lifestyle changes, which we're going to talk about, Dr. Sondhi will help them. So here we go. So the lifestyle changes which can help with the acid reflux is to avoid the common triggers. We have a picture of chocolate, wine, red wine, coffee here. So those are very common triggers for acid reflux. Um, and then raising the head end of the bed, if you can get a wedge pillow or put some cinder blocks, if your bed can allow that, by 6 to 8 inches will help. Again, by losing weight and exercising regularly, you can reduce your reflux. Eating mindfully, again, it ties in with losing weight and smaller portion and smaller meals. Smoking, believe it or not, does increase your acid reflux. Um, and then stop eating 3 hours before bedtime, I think, is critical, because longer the food stays in your upper part of your gut, which is stomach and small intestine, more the acid production is, more it's going to go up into your esophagus and give you the symptoms. Getting enough sleep, so that way you're rested, the gut is rested. Believe it or not, gut has a huge nervous system, second to the brain. So the sleep is important to rest the brain. Also, sleep is important to rest your autonomic nervous system in your gut. Again, a good pointer by Dr. Sondhi here is sleep on your left side. Avoid the spicy food, the chilies and all that. And don't view your reflux in isolation, as Dr. Sondhi pointed out beautifully. Let me bring you back, Dr. Sondhi. We have a question from the audience on this. Elizabeth is asking, can you speak how the alcohol abuse or overuse contribute to this? Uh, so that's she's talking a little bit different about viruses, but yeah, let's just talk about alcohol in general and effect on the gut because I know that's your research topic as well. And also it ties in with the reflux and the liver disease. So why don't you just talk about that and we'll just go a little bit sideways just to help her.
So, thank you very much for your question, Elizabeth. What alcohol does is it relaxes the lower end of the esophagus. Esophagus is a pipe. Imagine it's at the end of the pipe, there is a narrowing and there's a stricture. It's a pinch. And when you drink alcohol, that pinch goes away and the esophagus widens. When the esophagus widens, basically it's an open invitation for the acid and the other products in the stomach to come up into the esophagus. Now, the esophagus was designed just to carry the food from your mouth into the stomach. So it's a conduit. Esophagus wasn't designed to face too much of acid. When waves of acid come up the esophagus, that's when damage to the esophagus occurs. So esophagus has to be treated with respect. In other words, avoid the acid from coming from the stomach back into the esophagus. So that is what the role of the alcohol is, that it just decreases that pinch at the lower end of the food pipe, and then it basically opens up the esophagus so that the acid can come up.
That's a great point. That's a great point. Yes, and so alcohol and viruses. Let me just address that quickly. I know that was a little bit, not the main topic, but we'll address it anyway. So alcohol, as we all know, can cause alcoholic liver disease, and if it keep drinking, then it leads to cirrhosis, which increases the pressure in the portal system, and that causes the back pressure so it's like a varicose veins are similar to like your leg varicose veins, but there's more pressure in the leg, so and the valves are incompetent, you get varicose veins there. Same thing in the esophagus, you get varices there as well because there's so much pressure from the portal system, from the scarring of the liver and the spleen being enlarged, so that puts the blood flow backwards, and that's lead to the varices. So she also has an interesting thing to say about you, Dr. Sondhi. She said, Elizabeth saying, Betsy misses you.
Thank you very much, Elizabeth.
All right, so let's talk about the things you brought up here on this slide. What can we do if you have, let's say, Barrett's or GERD or heartburn? What can you do? So we touched on some of the issues, and alcohol was one of them, and spicy food was one of them, and smoking. But peppermint and tomatoes is another good pointer to avoid. And then the other issues to avoid is, again, smoking and not wearing very tight-fitting clothing, eating small meals. We talked about that, sitting upright. So that's a good point, sitting upright for at least 3 hours after eating. And we touched on losing weight, and we touched on veg pillow and raising the head end of the bed and avoiding late at night. That's pretty comprehensive. Dr. Sondhi, you want to add anything else to this piece, or
the only other couple of comments I'll make is people ask me, oh, doctor, chocolate is a hard one. So what do we do for chocolates? Everybody loves chocolates. It's, you become the bad boy when you tell somebody avoid chocolates or avoid coffee. There are a lot of other things which we can do. For example, we can drink decaffeinated coffee. And if you have to drink coffee, just restrict the intake of coffee to maybe 1 or 2 cups of coffee a day. And as far as chocolate is concerned, you can have some chocolate, but don't eat too much of it and every single day. So reserve it for special occasions, and when you eat it in moderation. So I tell my patients, eat in moderation and you will never go wrong.
That's a great advice. And, one of our patients is commenting that he's been taking the medication for 29 years. And we hear that in our practice too. That and I think that's a good point Terry brings up, and let's touch on it. So there's a lot of news about the proton pump inhibitors like Protonix and Nexium and Dexilence and the Prolosex of the world. What's the consequence of taking them year after year? If you can avoid it, as you get older, you should. Some people can, some people have Barrett's, they can't. But if you can, then take it as needed, because long-term use can cause calcium, magnesium issues or deficiencies, bone loss, rare cases, memory loss, increase infections of the gut like C. diff, um, to name a few. So yes, long-term use have side effects, but some people can't avoid it. You want to add anything else to that, Dr. Shanti?
Absolutely. I know there's a lot of bad publicity and press against the side effects of these medicines, but that is where a teamwork approach between you and your doctor comes in handy. These are medicines which are extremely safe. They're still over the counter, but don't use them if you don't have to use them. As Dr. Mahajan said, that if you can cut down the dose, you can cut down the dose. There are situations where we cannot cut down the dose, where somebody have Barrett's, or there are people who cannot miss even one dose a month. But those are special circumstances. Most of the times, we can decrease the dosage, decrease the frequency over a period of time. And let's say you do the endoscopy and you find that there is no permanent damage to the inner lining of the esophagus. And if that's the case, then your doctor would be much happier to cut down the dose, provided the other your symptoms are better. So yes, that's where you have to work in close cooperation with your gastroenterologist and your primary care doctor.
Great point, Dr. Shanti. And let's move to the next topic. We got a lot to cover. So here we go. So the causes of gas and bloating. Again, not a sexy topic, but but makes a lot of people uncomfortable when they have too much flatulence and too much bloating. And we get a lot of patients, asking us what can they do. So these are the common causes of having too much gas and bloating. If you swallow a lot of air, you should drink a lot of Coke or any soda pops. If you have, again, anxiety, again, tie into my comment earlier that gut is the second biggest nervous system after brain. So, that ties in with that. If your brain is nervous, your gut is nervous too. So, and we will touch on end of the show, as we always do, on the breathing exercises, which can help you here. Uh, Again, the carbohydrate indigestion. If your gut can't break the carbs properly, then the undigested carbs, as it goes down the gut, causes gas to get built up. The lactose intolerance is a common one as we get older. There's not enough enzyme to break down the milk products, and that can cause lactose intolerance. And then the bacterial overgrowth is a hidden one. We don't think of it, and I'll have Dr. Sandhi address that a little bit more, because we are seeing more and more of it now, as people are more aware of the other etiologies. Constipation is the obvious one. Celiac sprue is again a hidden one, and I'll have Dr. Sandhi talk a little bit more about that. So, Dr. Sondhi, you brought this list of etiologies, and that's pretty exhaustive. I want you to touch on a couple of them, the which are not as common in terms of diagnosis, and we miss them. One is the bacterial overgrowth, and one is celiac sprue. So, why don't you touch on those two first, and then you can touch on other topics as well, based on the time.
Okay, so let's talk about bacterial overgrowth. The bacterial overgrowth is a condition where you have too many bacteria which are growing inside our small intestines. As you know, our body is full of bacteria. Most of these are very good bacteria which live in peace and harmony with our cells of the body. We don't even know the names of so many bacteria. They're not billions, many trillions of bacteria which live inside us. But what happens is There are situations, for example, if your motility is disturbed, or if you have an operation or a surgery done in the past, or you take certain other kinds of drugs which can disrupt the good bacteria inside, and sometimes the bad bacteria take over, or sometimes these bacteria, which are normally present in very small amounts, they start growing inside us. And when they start growing inside us, they grow too many bacteria. So, what is the function of bacteria? They play baseball, they play football. I'm just kidding. What they do is they breathe, they ferment. When they ferment, gases are produced. And these gases have to go somewhere. They can go either up from the mouth and you can burp them out, or they can go the other way out. So, these is called bacterial overgrowth. What is the diagnosis? Just farting. Some people can have diarrhea. Some people can lose weight. Why would that be the case? Because the bacteria are going to share in your nutrition. They're going to eat your food, and then they could leave you with gases. How do you make the diagnosis? The diagnosis is made by certain breath testing. It is a simple test, but it's time consuming and tedious. We have labs where patients go in early in the morning in the daytime, and they basically have to take a deep breath in of a certain sugar. And if the bacteria are present in your small intestines, the bacteria are going to use that sugar and they're going to breathe out. And then we measure that breath of the bacteria in the air we exhale out. And that can give us a clue if somebody has too much bacteria which is growing inside the small intestines. And once we find that out, it's easy to treat because we have very good antibiotics. Sometimes we have to use multiple courses of antibiotics. Sometimes we have to keep on using different courses of antibiotics. So we have been discovering more and more of these bacterial overgrowth cases. Now, the second part of the question you had asked me was about the celiac sprue. Now, we think about 1% of the population has some form of celiac sprue, which is, in layman's term, wheat allergy or gluten allergy or hypersensitivity. It comes in various spectrums. Fortunately, most people do not have the severe form, which is celiac sprue. Most people can have a very milder form of gluten hypersensitivity, in which when you eat wheat products, you don't digest them. And when you don't digest them, what will happen? You basically can produce a lot of gas, and the other consequences of that, for example, you will lose weight and you become anemic. How do you diagnose this? The diagnosis is made by doing an endoscopy or doing some blood tests. Most of the times we end up doing all of them so we can confirm if somebody is gluten sensitive or has celiac sprue.
That's a great point, Dr. Sondhi. So let's bring a slide where we can help our patients do the lifestyle changes if they have bloating or indigestion. Here we go. So, number one is eating smaller meals so the enzymes in the gut has time to digest it so it's not overloaded. Number two is reduce salt. Again, it has to do with the fluid milieu in the gut. So more salt you take, more fluid accumulates, and it can cause more bloating in the gut. Look for food allergies. Dr. Sondhi just very beautifully explained the wheat. And let me also say that there is too much hype about wheat intolerance. And, again, you got to be very careful. It's not healthy not to avoid wheat if you're not really, wheat intolerant. So look carefully in your when you eat wheat products, and is it consistent that you get bloating, then yes, you may have it. But otherwise, don't get blown away by the recent fads about gluten-free. Cut carbonated drinks, that's a no-brainer. More air you're going to have, more bloating you're going to have. So, and that's not a good drink to have anyway. More water instead of the carbonated drinks. Try probiotic supplements. We're going to cover that in more length and end of the show when we talk more about GI health. And reduce sugar, alcohol, and we alluded to that earlier. Anything else you want to add, Dr. Sondhi?
Yeah, this takes time. So this also, it's not going to be a quick diagnosis. Most times patients get discouraged and disheartened. Please do not get discouraged, do not get disheartened. This again is a partnership between the patient and the doctors. It is a painstaking effort. The easiest and the first simple step I start off is by lactose intolerance, eliminating milk. Sometimes you don't even realize how much of carbonated beverages you drink, sometimes anxiety. So all these, even natural foods or even artificial sweeteners, can be a lot of gas producing substances. So just be careful, talk to your doctor about it, and hopefully we can find the cause of the gas and the bloat, which can be at times very unnerving to the patient.
Yes, great points. And, again, similar lines, what you're talking about, avoiding the foods like cauliflower, cabbage, broccoli, beans, and brawn. By the way, they are the best foods. So, be careful in eliminating them altogether, because these are the foods which get you beautiful nutrition in terms of fiber. So, don't just eliminate if you have mild symptoms. These are the one of the best food, Mother Nature, what I call superfood. So, those you should eliminate very carefully, not altogether. And, just for mild symptom, I won't recommend. Avoid sucking on hard candies and gum. Absolutely, these are useless foods anyway. Avoid milk. Yeah, that's something, it's a personal thing, but a lot of us become lactose intolerant as the gut get older. So that's and now we have a lot of milk substitutes. So that's not as hard these days with almond milk. And every time I go to the grocery store, there's a new variety of milk out there. So soy milk, rice milk, but again, that should not be that difficult to avoid. All right, so let's get to the next piece up here. I know that's a serious topic. The GI cancers. These are the top five cancer of the gut, cancer of the esophagus, cancer of the stomach, colorectal cancer, pancreatic cancers, and liver cancers. And let me bring Dr. Sondhi in. So, Dr. Sondhi, these are serious cancers, and in fact, colorectal cancer is, makes it to the top five, top four, cancers overall in the United States. So, those are important cancers to address, and some of them you can pick up, with proper screening, like colorectal cancers, and if you do it methodically every year, or colonoscopy based on the schedule you're going to describe. Some are very difficult, like pancreatic cancer. By the time you diagnose, it's already in most of the cases is spread, because that's a difficult cancer. We don't have a whole lot of screening tool, unfortunately, for that. But we can discuss the lifestyle changes so we don't get to the cancer. So that's I think is a take-home message is, yes, screenings are important, but I think more important is a decade after decade of good lifestyle. Add something up there before we get to signs and symptoms.
No, you said it very beautifully that most of these cancers are preventable, and pancreatic cancer, unfortunately, we have made a lot of progress into it, but we're still not at the point where we can diagnose it early. But we've had some good successes, some early successes. So let's hope that we can get pancreatic cancer. But a lot of the GI cancers are very preventable cancers, and lifestyle changes will have a great role to play.
Great. We'll allude to the lifestyle, again and again. So let's just get deep into the cancer signs and symptoms. All right. So these are the common signs and symptoms. As you can see, difficulty swallowing, that alludes to your esophagus and your stomach. Weight loss, that could be any cancer anywhere in the body without trying. Chest pain, pressure, or burning, again, it alludes to the esophagus and stomach. And Dr. Sondhi alluded to the worsening heartburn or indigestion not getting better with the standard treatments with H2 blockers or PPIs, or lifestyle changes. Then definitely you need a colonoscopy, coughing, or hoarseness. And that's an interesting one. And I see sometime asthma or laryngitis in patients who are smoker, and I get worried because, as we alluded earlier, smoking and cancer of the esophagus and stomachs are very tightly linked. So if you have cough and hoarseness, it could be from reflux, and you got to see your primary care. And and if it's something not infectious, then you need to get a upper endoscopy. You want to add anything up here, Dr. Shandy?
Yeah, as I said earlier, that do not ignore your heartburn. Heartburn is could be a sign of something bad, and if the heartburn is persistent, going on for years, always get it checked up. The risk of esophageal cancer is maximum in white men, which is adenocarcinoma, which is the part of the esophagus which just joins the stomach, and it is slightly less common in white females, less in black males, and less in black females. But the esophageal squamous cell cancer is much more common in African Americans. And those kinds of distinctions can only be made when you do the endoscopy. So first thing is be aware of the symptoms, number one. Number two is if it is there, do not ignore. Get a timely health. Even if esophageal cancer is found at an early stage, screening is important. We can cure it and treat it. And most people can have multiple years of productive life even with that.
That's a great point, Dr. Shandy. Here is the risk factors for the cancer of the esophagus. We alluded to the chronic heartburn, alcohol, obesity, uh, Barrett's, we talked at length earlier, drinking very hot liquids. Some cultures have that tendency, not eating enough fruits and vegetables. We're going to keep talking about that over and over again. And diet high in processed meat. And that could be any part of the gut, not just esophagus, that you can have consequences of not doing that on regular basis in your diet. And those are things which you can eliminate slowly. I know some people enjoy their bacons and sausages and all that processed meat, hot dogs, but just do it as a treat once a month or something, not every day for breakfast. And then radiation treatment, if you have it for breast cancer or any other cancer, that could be a risk factor. Eclasia, it's more technical. We'll leave it alone. Let's go to the next slide. Let's see. So the prevention is, again, don't do the things which are risk factors. Quit smoking, drinking in moderation, eat more fruits and vegetables, and maintaining healthy lifestyle. Let me bring Dr. Shandy again and see if he has. Do you have anything else to add on top of this for the cancer of the esophagus, Dr. Shandy?
And the cancer of the esophagus, the only other thing I'll add is once you've done those healthy lifestyle changes, people read on in magazines and hear on network news about the horror side effects of proton pump inhibitors. Do not stop taking these medicines on your own. If you have concerns, the best person to talk to your doctor before you give up on it. I recently saw a couple of people who saw the headline news, stop taking their medicines. One of them had an esophageal ulcer and had developed a stricture which was bleeding, and it was quite difficult to treat it. And another patient was on the way of developing a cancer of the esophagus. So yes, the medicines have some side effects, but at the same time, you have to weigh the risks, benefits of everything in life. So do not stop taking these medicines just because you read or heard somebody talking about the horrible side effects of these medicines. So just be aware, do not make a decision on your own.
And as Terry was saying, one of our patients that he's been taking for 29 years, we know a patient who's been taking since the Prilosec, the first PPI came, people are on it every day. And yes, there are rare side effects, and less medication is better. And this is one of the first medication I look at in a nursing home patient to stop, because a lot of time we have a tendency to give medications. They have a heartburn for a day or two, and we give it, and then no one stops it. But on those patients, absolutely. But if you have serious Barrett's, serious GERD, not a good idea to stop it. I totally agree with you. Let's go into the next topic, Dr. Shandy. If you have nothing else to add, we'll go into gastric cancers. The gastric cancer is cancer just below the food pipe, the stomach. So who's at risk? As you can see, the men are more likely to develop gastric cancer than women. Men age 65, 68 is the average, and the ethnicity is Hispanic American, Afro American, Native American, Asian Pacific Islanders. So those are the folks, unfortunately, have higher risk of getting stomach cancers. Then the genetics, if your mom or dad or immediate family has it, then you have a higher risk as well. It's a serious problem, as the 2020 data suggests 27,000 plus new cases. And once you get it, there's about, big mortality, 11,000 plus deaths. So there is some modifiable risk factors. We'll go at length. We talked about smoking, and then we'll add H. pylori bacteria in a minute, which is another treatable one, and large consumption of nitrates and nitrites. I will have Dr. Sondhi address that, and then specific workers who worked in coal mines or metal, rubber, or industries. Um, let's talk. Let's get Dr. Sondhi here in a minute. Okay. So let's talk about the food rich in nitrates and nitrites, Dr. Sondhi. What can you tell us, and what are those foods, and how much you need to consume so that your risk goes up?
So these are basically foods which are smoked meats. These are meats like hot dogs, which are processed meats. So most of these meat industry, which is based on processing of highly processed foods like hot dogs, all these bacons actually also uh, are actually not very healthy for you. So again, as Dr. Mahajan said, you can have it once in a while, treat yourself. You're going on a picnic, you're going for somewhere special. Once in a while, it's okay. But don't take it every single day, or don't take it for prolonged periods of times, because these kinds of foods over a period of time can lead to the formation of gastric cancer. Now, the great majority of the people will never ever have it. Similarly, like H. pylori, now majority of the people will never have any problems, but there would be a significant minority of people which will develop ulcers, pain, and even stomach cancer. So don't get the message that all these are bad, but we don't know. We don't have the capability or the technology to identify which patients will develop problems and which patients will not develop problems. So eat a healthier lifestyle, have a healthier lifestyle, and you will do well. So if you have an H. pylori, how do you find out? Again, there are multiple ways of finding out. You can do an endoscopy, you can do a blood test, or you can do a stool test. And if you find it, you treat it. And if you treat it, the risk goes away.
Yeah,
So
let's just talk a little bit quickly. The people who don't know what H. pylori is, a lot of people know about it. So the H. pylori is a very kind of slow growing bacteria which can reside in your gut for years and decades without being showing any symptoms. It's a bacteria which increases the acid production. In fact, one of the Australian pathologists who initially found it, no one believed him that it's linked with anything. And then later on, there was some lab data about maltomas, but definitely there is higher risk of acid production. So it's a slow-growing bacteria, as Dr. Sondhi said. You can diagnose it without invasive procedures in primary care practices as well. For example, if you come to me, and we can do a stool test for your H. pylori antigen, and there is a breath test. So you don't really need endoscopy, so there's no need to be afraid. The only thing I'll mention here is, if you are going for it, the only tough part about doing the H. pylori test is you got to get off the PPIs, and people who have symptom control and they don't want to get off. So that's the only problem with testing for H. pylori. But it's a simple test, and you can find it, and it's a simple treatment of 2 weeks of antibiotics, and 90% plus cure rate in most of the antibiotics, unless it's getting resistant to some regimens. So you definitely want to do multi drug regimen, not one antibiotics. You want to add anything else, Dr. Sondhi, to the H. pylori topic?
yeah, H. pylori is a very important topic, and we're seeing more and more people who, as we age, have more incidence of H. pylori. The younger age group have lesser. in the developing countries, most times by the time you reach the age of about 20, almost everybody in the population has H. pylori. But in more advanced countries, well-developed countries, most people do not have H. pylori till they're exposed to H. pylori in the middle ages. We don't know where it comes from. It can be coming from your water supply, overcrowding conditions. There was a theory about maybe the kids, when they are in daycare centers, they can get it from each other, throwing up on each other. That can cause H. pylori. Wherever you get it, it can lay dormant, or it can cause no symptoms for many, many years. And then lo and behold, you can have ulcers. So anytime you have a GI bleeder, always check it out.
Yeah, we got your fan saying, Andrea saying, love you, Dr. Sondhi. Yes,
Hi,
Andrea, we
Andreas.
all love Dr. Sondhi. Loretta, our patient, is saying great information, and she loves the gassy part of the information, the juicy part. We got, let's see who else we got. We got Pitwa Sweet Caro saying, you're the best, Dr. Mahajan. Thank you for your kind words. She said that I helped her in 2020 and her A1C went down from 9 to 5.5 in months. So, kudos to me. That's a miracle. For people who don't know, they'll say unrelated topic, but, the diabetes will come into play in GI as well. If you can keep your sugar this tight where, Miss Caros could get to, it's not me. It's a teamwork, and she followed through, and she did the lifestyle changes and exercises and watched her diet. So yes, it's a physician job to coach, but it's patient job to work together as a team, as Dr. Sondhi was saying earlier. So, but kudos to you, Ms. Caros, to get your A1C down to 5.5, and very impressive. All right, Dr. Sondhi, let's talk about the risk factors for this cancer of the stomach. You alluded to diet rich in nitrates and nitrites like bacon and the cured meats. So absolutely avoid those, folks. Just have it when you go to the hotels for the free breakfast. Otherwise, don't bring it home. Let's see, previous stomach surgeries. Any scarring anywhere in the body is always a risk, and it changes the anatomy, the gut flora, everything changes in that area. So less surgeries, better off we are. Unless, you have to, you got to. Poor drinking water, Dr. Sondhi alluded to that. Luckily, in first world countries, we have good drinking water, but, unfortunately, the infrastructure is going down in our country here in the United States. So it's good to check your drinking water. Every county has tests available, and you should check your drinking water periodically, make sure it's of good quality. Lack of refrigeration, luckily we don't have to deal with that in this country, but that's a big problem in third world countries. Lack of exercise, yes, we deal with that in all countries, third world and first world. So yeah, more exercise, believe it or not, helps you reduce gastric cancers. There is a famous person who just recently passed away from gastric cancer. Dr. Sondhi, you want to add anything?
Yeah, I think the single most innovative thing which has happened is the refrigeration. Before 1920s, the risk of gastric cancer was very high, and it's actually gone down. So the refrigeration has played a major role in cutting down the risk of gastric cancers. So in countries like in China, in Africa, and Iran, gastric cancer is still there, and it's a big problem. That is mainly because of H. pylori.
Yeah, that's a good point. The H. pylori revolution in terms of diagnosis, has helped us to reduce it. So let's talk about the big elephant in the room, the colorectal cancers. Do you want to talk about the instance of colorectal cancer, Dr. Sondhi, why it's so important to know about it?
Yes. So colorectal cancer is the most important because it's preventable, and if not caught in the right time, it can kill people. And now that it's so many testing is available, let's talk about it.
Okay.
So
Just let's before going the testing, let's just talk about the other issue. Is how it presents before we get to the testing. As you rightly said, there is no symptoms sometimes, so it's very important to do the screening, and we'll come to the testing part in a minute. And the other piece is not to ignore if you're older adult, if you get a colorectal cancer, if you get rectal bleeding. In fact, any adult, once you, unless you have strong family history, then earlier Dr. Sondhi will allude to that in a minute of genetic, predisposition and when to start the screening. But in older adult, absolutely rectal bleeding, you should take it seriously. All right, Dr. Sondhi, you were talking about how to diagnose it.
So basically, first of all, my first advice to everybody is do not wait for the symptoms to develop. I've had people who say, oh, I'm fine, I have no problems, I have no symptoms, I'm fine, I have no problems. Absolutely not. You want to catch this condition at an early stage before any symptom, any sign has a chance to present itself. That is the most important thing. Number two, colon cancer, once it starts, it can have some symptoms. By the time the symptoms start developing, you already have developed an advanced stage cancer. So what are the symptoms which can occur? Would be any new onset of abdominal pain, which is unexplained. Anytime there's a change in the normal caliber of stool, the stools are becoming too thin, too ribbony, or any change in the normal pattern of bowel habits, where somebody is constipated now is going to the bathroom every day, or vice versa, or there is blood in or around the stool, or anemia, fatigue, and unexplained weight loss. So you see, there is no one symptom which ties in. It's all a combination of symptoms. People may have no symptoms or may have one or two symptoms. So the symptoms are unreliable, but they can be, if you look at it carefully, they can be covering at the later stages. But unfortunately, by the time the symptoms come, it's already too late. So colon cancer symptoms, be aware of it, but don't wait for the symptoms to come.
Yeah, that's a great point. The best scenario is if you do the colonoscopy, which you're going to allude to in a minute, and you catch it early, and they are precancerous. You won the battle against colon cancer. You didn't let it put roots in your house. Once the roots go in, then it becomes trickier in terms of treatment. So, as you said, asymptomatic, but you're 50, or you're going to talk about that in a minute, about what age to start the screening. And while we saying, let's just bring it up. Okay, here we go.
Okay. So basically, colon cancer was in the news because of Chadwick Boseman. And unfortunately, when a celebrity dies, everybody talks about it for a day or two, and then it settles down. But colon cancer is not going anywhere. So be aware of it. Let's learn about it. How do you diagnose colon cancer? There are screening. What does screening mean? Screening means you have no symptoms, no signs, and we are doing this just to find a problem. Like you have a mammogram, you have a pap smear. Same thing is a colonoscopy or a colon cancer screening. So I get asked a question, doctor, which is the best test to diagnose colon cancer? The best test to diagnose colon cancer is the test which gets done, which means you can pick up anything. There is a cafeteria approach. But we always say, the American College of Gastroenterology says the colonoscopy is the preferred method of finding colon cancer. What are the other options? We can check for presence of blood in stool. We can check for Cologuard test. We can do a barium enema. What are the differences? Let's talk about that for a minute. For colonoscopy, you have to take a prep the day before. You have to lavage. You get the stool out of you, and then you have to go empty stomach in the morning for have the doctor do a colonoscopy, which is a long camera at the end of a scope with a light, and you go and look about 6.5 feet of the large intestines. The advantages of the colonoscopy are that when you see a polyp, you can take it out. What is a polyp? There's a little bumps which form as we age. They have no symptoms. Most of the times they could be little and they get bigger and bigger and bigger. And if they get more bigger, they can turn into a cancer. So the goal of the treatment is you catch them at an early stage and you destroy them, remove them. So the colonoscopy can accomplish the diagnosis and the prevention of colon cancer at the same time. Sometimes it can even treat it, because these are large polyps which can turn into a cancer sooner or later. So this is the best test. Why do people don't want to do a colonoscopy? There are multiple reasons. Mainly because some people don't want to take that prep. It's not comfortable. You have to sit in the john the whole day, and you have to stay on water, clear liquids the day before. So it's not an easy test to do, but it's a small price to pay for living long. Then there are other tests which can be done to find the presence of blood in stool. That's a stool hemoccult, which has been around for a long time. The problem with that test is it only picks up about 12% of the colon cancers. The other 88% of the cancers are not missed. And the other problem with the test is that you don't bleed every day. You may bleed some days, you may not bleed other days. So if the test is negative, it gives you a false sense of security, high degree of false positive. And if you had eaten some meat a few days earlier, it can be false positive. Now it generates more anxiety because you're worried about something like, why is this test positive? You can have hemorrhoids and they can be picked up as a blood, and that can show up as false positive tests. So all these tests can be very misleading at times, but they're very cheap. They have been historically done, and they are like stuck with us for now. Even though in spite of everything, we have not been able to get rid of the stool hemoccult. But at least it's something is better than nothing. Then we can do an X-ray test called barium enema. The old days, barium enema was a very good test. Barium enema is not a great test right now. Why? Because it can miss a lot of cancers, number one. And number two, if you find something which is positive, then you end up doing a colonoscopy. Same thing with all the other tests. Anytime a test comes back positive, then you end up doing a colonoscopy. The problem, which is practical, is it takes away your screening benefits. For example, if you do a Cologuard test today and the test is positive, it could be positive because of hemorrhoids. It could be positive because it only picks up about 90 or 92% of the cancers. It does not pick up any polyps. Or if it does pick up polyps, it picks up only advanced about 40 to 42% of the polyps, which means you may not have a cancer today, but you could have a cancer coming up in a year or 2 or 3. So that's why it needs to be repeated. It's not cheap either. It's about $700. So these days, the maximum amount of questions I'm getting about screening is about Cologuard test. So Cologuard is okay if, for example, somebody is elderly, is taking blood thinners, it's too dangerous to do a colonoscopy. On those patients, yes, Cologuard or any other test is a good test. But if you're a young, healthy adult, and those are the people who should have a colonoscopy, because you can diagnose and prevent colon cancer all at the same time.
All right, let's talk about is the colon cancer a disease of the old people? That's what I hear. Can you talk about that question?
Yes, I get that asked a lot, because colon cancer risk certainly goes up as we age. And as we grow more and more in age, the colon cancer risks go up. But recently, we have found a new trend that colon cancer is going up in younger adults. We don't know why is that happening. The risk of colon cancer is about 20% higher in 45 to 50-year age groups. And that's another very strange thing which is happening, and we don't know why. Is it the lifestyle? Is it the diet? Is it something we are putting in our body which we don't know at this point of time? These are all speculations right now. So we are basically mounting a big challenge to the insurance companies that we should start doing screening colonoscopies at age of 45, not at age of 50. And if somebody has a family history of colon cancer in a first-degree relative or a loved one, they should have a colonoscopy done 10 years before their relative was diagnosed with colon cancer. So the colonoscopies need to be done earlier to save more lives. And the fastest growing population segment is 45 to 50-year age group.
That's
Like
a
Chadwick
great point.
Boseman was...
We need to support that effort of doing the colonoscopy at early age. I'm just you know trying to get the lifestyle back in focus. I know the screening is important, and you touch it very beautifully, that get the colonoscopy. Even if you don't like the prep, is it's just important to do it. And then the advantages, as you rightly pointed out, and I'm just highlighting it, that while you're there, you can take care of the issue as well. You find a bad polyp is removed, so then your risk of cancer is eliminated at that point. So that's a beauty of colon cancer. Let's talk a little bit about good lifestyle changes which can reduce the risk of colorectal cancer. Again, smoking is important. Again, keeping your weight down is important. Why the weight keep coming up? We had Dr. Makani came to us on a previous webcast, and she's a cancer expert, and she talked about weight as well. And the weight and cancer has a strong link, because the adipose tissue is not just make you look ugly, it also produces a lot of estrogen and progesterone, and those have direct effect on the adenocarcinomas. So, and colon cancer is one of the cancer which could be adenocarcinoma. So, the adipose tissue has a serious effect on a lot of cancers. And exercises or regular exercise does keep your weight in check and reduce the inflammation markers, and and it's good for your overall health. So an immune system get robust, and it can fight the early cancers in any part of the body. So the exercise and not smoking and losing weight is a common theme we had with Dr. Makani as well, and Dr. Sondhi brought them up in colorectal cancers too. And again, we talked earlier about the cancer of the esophagus and stomach, the fruits, vegetables, and whole grains, eating more of it, the Mediterranean kind of diet, which is good for your brain, good for your heart, is good for your gut too. So the body is not in silos where you need a X amount of or X kind of food for your gut, or X kind of food for your brain health, or X kind of food for your heart health. If you look at it, it's a common theme: more fiber, more fruits, more vegetables, more whole grain, less smoking, less alcohol, keep your weight down, regular exercises. It helps you from head to toe. Do you want to add anything else, Dr. Sandhu?
Yeah, this ties in so beautifully to our healthier lifestyles. Less heart disease, less heart attack, less stroke, less cancers of all kinds, including GI cancers. And as we see, we are what we eat. And if we eat junky food, there's a high risk of us having heart disease as well as cancer. So there's a common theme that bad lifestyles can cause heart disease, can cause cancers of all different kinds. So if we are careful, yes, we can do something to our body and live longer and more fruitfully.
That's a great way of saying junky food. I love that word. I think your boss is chiming in, so let's say hello to the boss, Anju the Great. She's saying screening colonoscopy is important because that pays for her car. So she is absolutely right. No, but she's absolutely right.
No, I had to work on her for 3 years before she agreed for colonoscopy.
Oh, really?
Yeah.
She's saying for other people. It's easy to say for other people. No, she's amazing. She keeps you straight, Dr. Sandhi. So don't say anything bad on the air for her.
No, I'm not.
Mr. Gupta is saying thank you for the useful information. Thank you for watching, Mr. Gupta. Stephanie is saying, love you both, Dr. Mahajan, Dr. Sondhi. Thank you, Stephanie, for your love. We feel it. Thank you. And then we got Andrea saying, love you, Dr. Sondhi. So thank you and then we got Rupa saying, good information, well explained. Thank you for the education. Thank you, Rupa, for watching. Let's go to a biggie. And I know, once you tell that patient that they have that and they're get it very sad, and and it's a serious diagnosis, and we're talking about the biggie, the pancreatic cancer. It's a serious cancer because of the poor prognosis it brings. By the time you diagnose, it's stage 4, which means it's gone to the lymph gland, it's gone to out of the tissue in the pancreas. So that's why we are so afraid of making, not afraid, but if we give someone the diagnosis, we know that the prognosis is poor. So that's why it's good to know the symptoms. Sometimes we have picked them up early. So it's good to know if you have those symptoms. And again, the symptoms are very similar to other cancer, which is loss of appetite, weight loss, fatigue, malaise, upper abdominal and back pain. And that's an interesting point, the back pain. The reason for the back pain is because the location of the pancreas. The pancreas is what we call retroperitoneal. That means it's in the back of your body. And again, these are the symptoms, the abdominal pain, the back pain, the nausea, the loss of appetite, weight loss, pain after eating, indigestion. And we'll have Dr. Sondhi talk about, what else we should know about pancreatic cancer. I know it's a difficult condition to treat.
Yeah, pancreatic cancer is very difficult to diagnose or treat in the early stages. And unfortunately, we don't have good screening for that right now. So the best we can do right now is guys, just keep a track of your weight. And if you don't smoke, good. Do not start smoking. And if you are smoking, cut down or quit. Better to quit. And if you can't quit, at least cut down. The more you smoke, the more the risk of pancreatic cancer. Diabetes is a long-standing risk factor as well. But most people don't have these risk factors. But the ones which you have, you can identify them and do something about it, which means modify those risk factors so your odds of developing pancreatic cancer in the future is decreased. So what you work today, fruits will show in 10 years, 15 years, or 20 years. So
That's a
my
great
only
point, Dr. Sondhi. And, with the advancement of the endoscopic ultrasound, we have better tools now to, do the biopsies and offer palliative treatment with stents and all that. So the tools have improved, but you're right, we're not there yet. Even with the best money, the Steve Jobs couldn't save himself from pancreatic cancer. So, these are serious cancers. But again, lifestyle, as you rightly pointed out, alcohol consumption, you can reduce smoking, chewing tobacco, fatty foods. If you can do that, it will help you overall health, not just pancreatic cancer, but reducing other cancers too. Let's talk about another cancer, which we don't talk as much, but some of it is avoidable. Risk factors is the liver cancer. The why we brought it up is again because the lifestyle changes can change your, reduce your risk of getting liver cancer. If you have Hep B, Hep C infection, get it treated. And then if you get it treated, keep yourself under surveillance with the ultrasound and tumor markers. So, that's another, and if you have risk factors like, frequent blood transfusion before 1990s and multiple sexual partners or IV drug use when you're young, the Hep B, Hep C can stay in your liver for lifetime. So it's good to get that blood tested, part of your annual physical. And, if you get it treated early, we can reduce the risk of you getting hepatocellular cancer. So that's something I want to emphasize, that think about your lifestyle, not just now, but in the past. And that can come back and bite you if you don't, get yourself checked if you had that kind of lifestyle in the past. And then immunosuppression drugs, which are unfortunate, you got to take it, if you are on transplant or something, or chemo. Excessive alcohol use, we talked about that. That has direct implication in liver cirrhosis and hepatocellular cancer. Smoking, again, is a common thread in all the cancer of the gut and other cancers too. And then the fatty liver, that could be a player. Anything else you want to add to that list, Dr. Sondhi?
Sure. The number one cause of colon cancer, of the liver cancer right now is hepatitis C. And fortunately, we have good treatment for hepatitis C, and it is the only viral infection which has been treated now. You have a 3-month or to 6-month treatment, and you're done. One pill once a day, easiest cure. Only a problem is accessibility, which means cost, but that's coming down too. So we've been managing to control hepatitis C. That will help with liver cancers. The other problem with liver cancer is the biggest one, which I see right now, is obesity, fatty liver. So one thing which you're going to be hearing more and more is fatty liver. What is fatty liver? Excessive fat in the liver. Why does that happen? It happens because of obesity, diabetes, high blood pressure, metabolic syndrome, and some people have just genetic predisposition to have more fat in the liver. So don't ignore that. How do you diagnose that? There's a test called fibroscan, there's a test called ultrasound or CAT scan. We don't specifically go looking for these conditions right now, but if somebody has high liver enzymes and then you find that the patient has fatty liver, that is a bad combination. How many people with fatty liver will go on to develop complications? It's about less than 5%. But these people can go from fatty liver to straight to liver cancer without developing liver cirrhosis sometimes. So all I'll say is be mindful of the fact, make sure you don't develop fatty liver, and if you have fatty liver, do something. There's no FDA approved treatment for that. The best treatment you have is cutting down on the things which we have the common theme, cutting down on soda drinks, cutting down on high calorie foods, decreasing fatty foods, and exercising. Lose weight. There's studies done now which show that if you exercise, and you don't have to lose a lot of weight, even if you lose 5 to 10% of your weight, your fatty liver can go away. We should have some drugs coming in the market within the year or two, and that would be a welcome thing. But at least if you can do manage without drugs and just do lifestyle changes, that would be the best thing. What is the best drink? Coffee. I have converted some of my patients from soda drinks to coffee. 1 or 2 regular coffee drinks, not decaffeinated drinks, will prevent a lot of fatty liver also.
Yeah, I think that's a hidden epidemic we're seeing anytime you do ultrasound for unrelated causes or CAT scan for unrelated causes of the belly. We're seeing people having fatty liver, and that's just because of the lifestyle. With COVID, more sedentary lifestyle, more stress eating. So very important, as you rightly pointed out, and that even if you don't lose weight, even if you exercise for the sake of exercise and you do it consistently, it will make a beautiful impact on your liver, on your heart, on your brain, and it won't, cost you anything other
Right.
than your willpower. And you can
Right.
do anything. I have chair exercises in my office on the screens for the older folks who have arthritis of the hip and knees and back pains. They can sit on the chair and do the exercise. It's just the willpower to do it. We got some lovely comments. Let's get them in here. Deanna Frank is saying, wonderful program today. Thank you, Deanna. You're so kind. You always watch our webcast. And Ray Davis and Carolyn always watch our webcast. And they're saying, thank you, Dr. Mahajan, Dr. Sondhi. Thank you, Ray and
Thank you.
Caroline, for watching our webcast. I know we covered the GI malignancies and we rushed through it because there's a lot to cover. But you also brought a beautiful slide, and let's make it into a big class, prebiotics and probiotics. So what are prebiotics and what are probiotics? The prebiotics, guys, is the scaffoldings. So in other words, the gut needs nesting space for the good bacteria, your microbiome, to thrive. So what constitutes a prebiotics? That means before we add the friendly bacteria, we need to provide them friendly homes. And how do you get the prebiotic? Let's bring that slide up there. So if you look through this slide, these are the food that support healthy gut. And if you look at it, it's interesting because onions, garlic, bone broth, pineapple, asparagus. We'll talk about sauerkraut in a minute. But if you look at 2, 3, 4, 5, 6, there's no fermentation going on there. They just have, what we call fiber, the good fiber for the gut to thrive. And then you look through the rest, and again, number 10, the dandelion greens, again, is fiber. Now let's talk about the rest. The apple cider vinegar, kimchi, ginger, again, is prebiotics, and the sauerkraut. Now those are fermented foods. Fermented foods, it could be buttermilk, could be kefir. We didn't add that to the list, but you can add yourself to your list. Kombucha is another drink. These have Mother Nature provided good bacteria which are good for your gut. So you don't have to spend money on buying those probiotic medications, which are, we don't know what temperature they've been stored, and the microbiome is a exploding field, and we are barely scratching the surface. So I rather have a fermented drink, what we just alluded to, the kimchis of the world and the sauerkrauts of the world, then have a probiotic pill, which I don't know what's in there and how much live colonies are in there. So if you combine the prebiotics with probiotics like ginger, garlic, onions, any form of greens, any form of fibers, any form of fruit with skin, you will have a beautiful home for the friendly bacteria of what you're introducing to your fermented drink. And also the body has been given the microbiome over the lifespan from your parents, from your friends, from your colleagues who you work with. So you do have your unique microbiome, and you need to keep nourishing it, keep making it happy. And the best way to make it happy is, again, less stress, less anxiety. Again, it comes down to autonomic nervous system, a lot of hydration, mostly water, and nothing carbonated, nothing processed, nothing lunch meats, and giving, if you want to, kefir and buttermilk and other fermented drinks. If you use that combination consistently, I think your gut will sing praises for you. You want to add something more, Dr. Sondhi?
Yeah, that's what the common theme of the day is, that we have healthy lifestyle, lose weight, not smoke, don't drink, eat the good bacteria, eat the good foods, and hopefully will prevent cancers and prevent all kinds of different GI as well as other conditions. So I agree, make your healthy bacteria, friendly bacteria your best friends, and hopefully you live long.
Great point. Let's bring a couple of comments. Tammy is saying, "You're awesome." Thank you, Tammy, for your kindness. Loretta had a question, and I'll address with you. When she was young, she had jaundice and she was quarantined. So what she's talking about is hepatitis A. So again, we talked about B and C. We didn't talk about A. The reason being, hepatitis A, unless you have immunocompromised liver or compromised liver like cirrhosis, then it could be deadly. But otherwise, you will get sick. But in 3-4 weeks after you get jaundice and you go through your sickness, the body immune system will handle it, and the liver will get damaged, but then it'll get better. And it does not linger to cause cancers, cirrhosis that we know of so far. It's more infectious disease. And we have pockets in Pinellas County of hepatitis A, so you should be careful with the restaurants. If you get jaundice and diarrhea, it could be hepatitis A. So you should bring to the physician attention if you get that. The other good thing about hepatitis, there's a good thing about hepatitis A, is there is vaccine available. So for the folks who are getting cirrhosis, God forbid, or advanced liver disease, we do recommend that you should get the hepatitis A vaccine in Pinellas County, and you can get it from health department. And same thing applies to hepatitis B vaccine. Unfortunately, we don't have hepatitis C vaccine, which will be nice once it comes. But hepatitis B vaccine, you should get as healthcare workers, nurses. There are a lot of nurses and physicians who listen to our show, and you have to do it anyway because human resources won't let you go through, which is good. But other folks, if they have liver disease, they should get both the hepatitis A and B vaccine. You want to add anything else, Dr. Sondhi?
Yeah, and the liver also is basically the same things, and losing weight and making sure you are doing all the right things. The only other thing I'll say is get coffee, which is the best drink. You can Google coffee and liver, and you will see what I'm talking about. And you see that you live longer. And hepatitis A has been an epidemic. Thankfully, it has been contained. I don't hear about hepatitis A since the COVID crisis started. Before that, for the last 2 years, there were multiple pockets of hepatitis A. I don't know if it went away or we just stopped talking about it.
Maybe people are going to the restaurants less.
Yeah, and eating
All right,
less
so
seafood.
let's wrap up. We had a lot of topics we covered. Let's just rehash the people who joined late. We have a wonderful guest, Dr. Sondhi, today on our show. He's a board-certified gastroenterologist. He has a practice in Clearwater. He does come to local hospitals. And I known him for 20 plus years, and we share a lot of patients in common, and they all come happy with his what he does, and he has wonderful bedside manners. And we'll put his number on our comment section. So if you need to consult him, he takes lots of different insurances, so you can consult him for your GI issues. So that's about him. But people who don't know me, who join late to my show, I'm a board certified internist, and I do shows. And now we're going to be doing once a month, so please note it down. It's going to be on second Wednesdays of the month. So every second Wednesday of the month at 4:30, we're going to have a great guest and thought leader like Dr. Sondhi on our show. And we're going to continue with the breathing exercise today. The show was long, the topic was long, so we're going to skip it. But we'll have the breathing exercise at end of the shows as a tradition that we're not going to skip. Let's just highlight what we covered today, Dr. Sondhi, and you can add if I missed anything. For all the cancer from your esophagus all the way down to your rectum, it could be avoided. So that's the take-home message. If you start, and don't pick up habits like smoking, drinking too much alcohol, all those cancers in your gut can be avoided. So that's number one take-home message. Number two take-home message, as Dr. Sondhi very beautifully said, the body is a temple. Give good offerings. That means give good food, folks. What keeps the cancers and the infections and the inflammations away. So high fiber diet, a lot of plant-based diet, anything which comes from plant, eat more. Anything which is made in a plant, which means manufacturing plant, give it to the boyfriend or girlfriend you don't like. Like processed food, like bacon, like pork, red meat, processed meat, less, and then exercise regularly and sleep well. Sleeping is beautiful for immune system to recover. So if you do that consistently, not only your gut will be happy, I think your whole body will be happy. With that, we come to the end of the show. We want to thank Dr. Sondhi for coming to our show and sharing his time. And I know he's very busy. We want to wish Dr. Sondhi and his family a happy new year, and hopefully COVID-free for all our listeners. And we will see you on next webcast on next Tuesday. Thank you, Dr. Sondhi.
Thank you, Dr. Mahajan, for inviting me.
Yes, sir. Bye-bye.
Bye-bye.
All right, guys. So that brings us to the end of the show. And thank you for listening. And if you have any topics you want to cover, please put in the comment section. Give us likes and wow, so we can know that you guys are enjoying our shows, and keep doing the good work, and be nice to yourself, and nice to Mother Nature, and nice to your fellow human beings. Namaste.